Hi guys, so I'm going to go ahead and do a recorded lecture. This is what I would lecture on the first day of class. Um, by now, hopefully you have listened or reviewed your previous chapters over growth and development and the specific chapters. This will be the final chapter that will be on exam one. So I'm going to go ahead and start. This is on family dynamics and communication with children. So, components of effective communication. There's a lot of different ways that we can effectively communicate with pediatrics. So, one area that is always kind of, uh, pardon the pun, touchy subject here is about touching. Keep in mind that you always have to get permission to touch your patients. But with children, especially, touch can be a very, very powerful and effective way to communicate with them. So when you're dealing with like infants, for example, they sense emotional support and they respond to being held, cuddled, or even, patted on the back. It's that trust versus mistrust that you're dealing with. So touch is a very great way to respond with infants. Toddlers, preschoolers, they often are going to be receptive to being held or being rocked. School age adolescents may appreciate a hug or a pat on the back or the hand, but again, you have to get that permission for anything beyond casual contact. Physical proximity, when we're dealing with pediatrics, it's really important to sit at eye level or to squat near the child. Some places even encourage, sitting on the bed or the floor. I don't encourage you guys to sit on the floor, especially in a hospital environment, just because of the germs and everything. But you need to get on their level. And we talk about this with our adult patients. We should actually be getting on their level too, but it's really, really important with pediatrics. Your environment, it needs to be kid friendly. And if you guys have ever been to a pediatric unit, you'll see that they have small furniture. It's very brightly colored. This is kind of why, I don't allow you guys to wear your white uniforms when we go into a pediatric setting, because children respond better to the bright colors. They think of white as sterile and frightening to them. So their environment has to be inviting. Listening, being a good listener is difficult for some nurses. We are really good at multitasking. So when you're dealing with the pediatric patient, you want to avoid multitasking and really take the time to listen to concerns. And not just for the child, you need to listen to the concerns of the parents. A lot of times that includes clarification. We talk in that ADN 201 class about empathy versus sympathy. You want to be empathetic, and it's really hard with pediatrics to not fall into that sympathetic characteristics. So we want to empathize. And then also impartiality. It's important to remain objective and to avoid being judgmental. And this gets very, very difficult when you're looking at parents and their parenting styles. You got to remember to avoid being judgmental. Visual communication, some are visual learners. Demonstrating what you plan to do or allowing them to inspect the equipment will help with communication. This is very, very important with that preschool age. My daughter right now is in a great time where she acts out things with dolls and she wants to handle the equipment because that's how they understand things. So you got to keep in mind the growth and development and the level of your child when you are trying to communicate with them. Tone of voice. Infants and older children, they detect anger and other feelings through our voice. So with pediatrics, you want to use that calm, that soothing voice. A lot of times what you would expect with, mental health, you want to, really, really watch that tone. You also want to watch the pace of your speech. You want to try to avoid speaking in a hurry, and we definitely don't want to use technical terms. And we talk about this with adults, but it's even more so with pediatrics. You can't use medical jargon. You just can't do it. And for body language, we lean towards the child. We keep our arms loose at our sides, calm, slow movements. You don't want to startle them, okay? So tips to enhance listening and communication skills. So you want to remember that children understand better than they can speak. So a lot of times they do understand what we're saying, but they just can't articulate the answers back to them. We always want to ask open-ended questions. You don't want to give someone an opportunity to answer yes or no and stop the conversation. Open-ended questions allow them to expand upon. You want to increase comprehension by using different methods to present and share information. So one of the things that you're really going to have to focus in on, especially with pediatrics, is do they understand the discharge instructions, or do they understand what we're trying to teach them in the hospital? So a lot of times you're going to utilize multiple versions, so written and verbal instructions. And if we taught them to do something, you want to make sure that they can do the return demonstration. This is going to optimize our patients when they go home to have the best teaching that they had, and it gives you a great idea as the nurse to whether they understood what you were saying, and it helps open that dialogue between the child, the parents, and the nurse. Another thing to use is what they call people first language, and this is something that I know I struggle with as a nurse. So we need to get a habit of referring to the patient by their disease. So a lot of times we'll say, oh, the COPDer in that room, or the asthmatic in that room. We want to say the child with asthma or the child with cystic fibrosis. That is using people first. It identifies them as a person as opposed to their disease or even their room number, which is what we see a lot of times too. So communicating with the families, this can get very, very difficult for a lot of people. So when we're communicating, you want to include all involved family members. So this is where it gets difficult, because where do people, draw the lines on their families? You also want to encourage families to write out their questions. So few times we actually have the time to sit down and really address all their questions. And a lot of times, and I know I've experienced this when I go to the physician's office, is that after I leave, I'll think of 3 questions that I meant to ask, but I forgot to. So if they write down their questions, it makes sure that we can maximize our time and hopefully get all of their questions answered. You want to remain non-judgmental. And again, guys, you're going to see this the more and more we talk about these diseases. You got to keep in mind that not everybody parents the same way. Not everybody raises their kids to believe the same thing. So our job is to maximize growth and development of our patients. And so to do that, we have to seek out, and I'll talk about in a second, these win-win solutions. And to get to that final solution, it's really important that we remain non-judgmental. You're going to give both verbal and nonverbal messages that express availability and openness. So some things that I'm definitely seeing a trend, especially in the last 15 years, is that we've got to gain the parents' attention a lot of times, especially when we're asking questions. We get so easily distracted by our devices, our phones. So when you are educating a parent or you're trying to ask questions about their child, you got to gain that parent's attention. So you may want to ask them, please put down your devices so that I can obtain that accurate information so I can give your child the best care possible. So while you're doing that, you're expressing your availability and your openness, but it also gives that parent the opportunity to speak to you and as the expert of their own child. So that kind of goes with that respect and that encouraging of feedback, okay? A lot of times we're going to have to work together with the parents so that we adhere to their parenting styles, but still maximize the growth and development of the child. You also want to remember that families have a variety of shapes, sizes, colors, and generations. So again, when you're involving the family members, you may want to ask the parent, who do we need to include in this conversation, okay? There's so many different types of families anymore. And so we want to make sure that we are adhering to whatever the diversity is in their family, and we want to respect that family diversity. And importantly, you want to avoid assumptions about family beliefs and values. Something that I do want to include that I didn't write on this slide is we live in an area that is very, very diverse. So a lot of times, you're going to be dealing with patients where English is their second language, and this can cause difficulty with understanding instructions. So keep in mind when you're communicating with these families, a lot of times these children speak English better than their parents. You are not to use the child as an interpreter. We have interpreters available in the hospitals 24/7, and they've made it very, very simple for us to communicate with these families, okay? So keep in mind that we always want to get an interpreter in anytime we're discussing anything about the child, because we want to make sure that they understand the instructions. And by not having that interpreter there, it's going to cause difficulty with getting them to understand what we need them to understand. So now we're going to talk about strategies for managing conflict. Okay, so it's important whether we're talking about conflict between the nurse and the parent or conflict amongst the caregivers themselves. So our job is to be impartial. We want to try to understand the parent's perspective. So we want to establish a common goal and stay focused. We want to encourage them to openly express their feelings. So an example could be, as the nurse, you could say, I'm very concerned about your child's safety when you leave the side rails down. We want to make sure that we avoid any blaming and pointing fingers. And if there is a conflict between family members, the focus should be on finding a solution that has them work together to resolve the problem. And that's going to allow you to be more productive with communication patterns. So approaches to facilitate interactions with children. So play is something that I talk about a lot in pediatrics. So through play, a child can actually express thoughts and feelings that he or she could not verbalize. They use storytelling. So you can read stories based on issues that the child may be facing, or the child may want to share a story. And depending on the age of the child, some kids are very, very good at making up stories to help them work through some of the feelings that they see. You want to explain procedures. It's very important to know the procedure and what it involves. The information that you give should only be what the child will experience directly. Sensory related to allowing children to handle certain equipment, possibly like on a doll, like I said. They're very equipped to smells or a feeling. So you could give them, alcohol pad, for example. If they can smell it, if they can touch it, it's not going to be so scary for them. For that school-age child, preoperatively, if they're having a procedure, 4 days prior for explanation with the use of a book is often really, really useful. And keep in mind with their self-esteem, you want to praise them, even if they did terrible, okay? Even if you had to chase them around the room, you still want to praise them for what they did well. Whether it's their listening, we always make sure that we're honest with them because we want them to trust us. But with pediatrics, we also have to set limits, and it's important that we don't exceed those limits. We don't give in to them. We have to set the limits. We make sure that the parents understand the limits so that we're all on the same page there. Other things that I want you to remember is that parents are the expert in knowing how to communicate with their child. So we have to seek out the parents on this and make sure that we are all on the same page. All right, and that is going to wrap up this lecture on communication. Thanks.